Hello, this is the 1 month update to the anterior hip surgery hip replacement. It's not quite 1 month. It's Saturday. Monday will be the fourth Monday since the surgery. But first, take a look at how I'm walking, and I will tell you about what's been going on for about the past week. There you go. So walking normally, no pain. And so let's talk about pain first. If you can see, if I press my finger in the side, there's tenderness on the side of my leg. Nothing over the incision site, just a little bit from about here to here, a little bit of tenderness. And check this out, range of motion, right? So left knee, I can do this. I can get that far and it's stiff, that far and it hurts. So the range of motion is not completely there, but it's only been a month. And I can tell you that the thing that, let's get out of that light. The thing that was one of the surprising things to me isn't the pain. The pain's been, at the most 4 out of 10. For the past couple of weeks, 3 out of 10. It's fatigue, is that I do very little and suddenly I'm very tired. So fatigue was kind of a big deal. They warn you about overdoing it, but here's the thing. You don't know what overdoing it looks like until you do it. So there were 2 or 3 times where I walked too much and did too much, and I got some swelling and pain at the end of the night. So I used my Apple Watch to track my steps, and I made sure, like, if I had a 4,000 step day and that was too much, I made sure I kept 500 steps under that the next day. And then I would slowly work my way up to 4,000. And if 4,000 was good, I'd add 500 onto it. I had a 5,000 just 2 days ago, 5,000 steps, and I was fine. Minor lifting, at first, no more than 10 pounds. After a month, I'm lifting 20 pounds and I'm okay. I still have to be careful. I tell you, this whole thing has been so much better than, I don't know, can you guys see Dottie here? There's Dottie. She's not as worried about me anymore. So it's been quite a road, and this is the last official hip replacement surgery update in the series. I'll give updates on my regular videos occasionally on how I'm doing, if there are any setbacks or anything. The only complication I had was a seroma over the incision site, and when I went to see my doctor about 10 days ago for the follow-up, he drained the fluid out of that seroma, and it hasn't come back, and it's not tender. The fluid hasn't come back. So I'm in really good shape. I've lost some weight, hence the suspenders, because my jeans were falling off me. It was interesting, in the first week after surgery, I had a ravenous appetite for about 10 days. And then after that, my appetite started to go down. And now it's, I have to have a lot more activity, taking in less calories. So I've been losing a little bit of weight, but that's not bad. I still could stand to lose 25 pounds, and that would be nice. It's one of the things that the surgeon said to me. I asked about my other hip, and he looked at it and he said, it looks good right now. You could go 10 years, you could go 15 years. There's no telling. And I said, well, what can I do? And he said, lose weight. Gravity and weight's your main enemy there. And so I'm going to continue to hopefully lose a little bit more weight. I'd like to get sub 200 pounds. I'm about 220 now, and I'd like to get to maybe 190, ideally 180, and that would be great. And we'll see if we can get there. So what else can I say? If you have any questions, the last video is a good thing to ask questions about my experience. I'm not going to give medical advice. What I will do is I'll share my experience with you. I did Tylenol, extra strength Tylenol, for my pain control. There was one night where I took, I think, overnight 2 oxycodone, and that was it. And I was a little nervous about it because I've never taken a medication like that before. And I thought, am I going to feel lightheaded or high? Or no, not at all. I didn't, in my head, I didn't feel any different, but the pain did subside a little bit. So that's all. In retrospect, it probably wasn't necessary. The Tylenol probably could have done the job the whole time. So I came close to using none of that medication. What else? You know, if I can recover in a 21-foot by 7-foot trailer, that it's hard to imagine. You know, I was really skeptical because I was trying to talk my doctor into writing an order for me to go in this rehabilitation place for at least a week. And he's like, Rob, I'm telling you, it's not medically necessary. You don't do it. You don't need to do it. I've had patients doing the surgery, going back to their trailer in Quartzsite, and they did outstanding. And I'm so glad that he knew that and told me about that, because I was so much more comfortable at home. And thank God for Cheryl and Barb, who you know, were there for me. In particular, you know, other people helped me, but those two in particular. Barb was with me the whole time during the surgery. It was a huge comfort to me on a day where I was pretty scared. And then Cheryl, Nurse Cheryl, was there every single day, multiple times a day, helping me out and you know, being a nurse. And what more could someone ask for than friends like that? I'm trying to think of what else I can tell you. I told you about the fatigue, the pain, overdoing it. I still have to be careful. But I don't plan on moving up. I'm in southern New Mexico now, and I'm going to be moving on to northern New Mexico, but probably not till the end of May. So I'm going to stay put here for a while, and so no traveling. Traveling was hard. I was tired. It took 3 days to get from Quartzsite to where I am now, and that's, you know, I'm in southeastern New Mexico. It took 3 days, and even so, having those short trips still was pretty exhausting for me. So. But I was grateful I was able to do the traveling. I was worried that I'd have to stay in Quartzsite longer, and I didn't need to. Isn't that great? If you missed it when I first, in like the first video, I think, the day I came home and was lying on the bed, you know, with the fresh wound and, you know, fresh from surgery, both Dottie and George were up in the bed, lying next to me with both their bodies snuggled up next to my leg, and neither one of them would move. In Dottie and George being that close sleeping, that never happens. Dottie just barks until George runs away, but not this time. And it tells you the sensitivity that our pets, animals have to what's going on. They could sense, I think, through scent, that there was a injury, there was a wound, and it was fairly serious. So they were worried. And for the first few days, first week I couldn't walk Dottie, and Cheryl would try to walk Dottie, and she'd have to pull really hard to get Dottie to even walk away from the trailer to go to the bathroom. She wouldn't leave. But she's okay now because she knows I'm okay. Oh, is that I'm okay, you're okay? Wasn't that a book like in the 70s? I'm okay, you're okay. Anyway, that is going to be today's video. I hope you enjoyed it. And like I said, if you have any questions about my personal experience with the surgery, ask away and I'll answer them. Take care, and I'll see you on the next one.